This exercise is designed to release the muscles in your back. I'll show them right here, but specifically the one that we're going to look at is called your QL. What your QL stands for is Quadratus Lumborum. It is a muscle that works really hard when your core doesn't work or your glutes don't work, and it stabilizes and holds on for your dear life. It's located right next to your spine. We're going to use a tennis ball or a lacrosse ball to try and release it. I'd suggest starting with a tennis ball. It's squishier, which means it will give more, which means it won't put as much pressure into your back muscle. I'm going to use your lacrosse ball, so that's appropriate. That's the best for me. What we're going to do is, you saw where that muscle was. We're going to place the ball not on our spine and not on our pelvis, but right in the love handle area. You're going to keep it there, and you're just going to lay down on the ground. Get used to this position. This is just the beginning of it. You can feel that pressure into that muscle. You can adjust as needed, roll around on it. When you find a tender spot, just hang out there. If you want to make it a little bit more difficult, start to do some pelvic tilts. So what I'm thinking is my pelvis is tilting under, more pressure, and it's tilting up, less pressure. More pressure, less pressure. And then you can also think ribs. This is hard for a lot of people, but drive your ribs under, let your ribs come up. What this is doing is contracting your core, so if you have to think about that, squeeze your tummy muscles, dig your belly button down, push your belly button out. Anything you can do to engage those core muscles will stretch and lengthen out this QL. Underneath the ball is a nice muscle release. If you want a little more aggressive, my body's right now facing upwards. I'm going to start to tilt it a little bit to the right. So I'm now oriented upwards this way, and the ball is pushing up into my spine a little bit more. This is more aggressive for me. This feels much nicer because it's a little bit more aggressive. The ball's driving into there, and then you can start to do the pelvic tilts again. Tilt back and forth, more pressure, less pressure, more pressure, less pressure. If you know your tilt movements, posterior tilt, more pressure, anterior tilt, less pressure. Posterior more, anterior less. If you want to progress a little bit further, let's do a major posterior tilt of that pelvis, so more pressure. Bring this knee upwards. Whew. Drive that knee and just hold it there. Now we're staying in a maintained posterior tilt, and that muscle, QL, is getting lengthened underneath the pressure, so this is a good self-massage. This is the last progression. If you're here and you need more, you just breathe into it. So take a big deep breath in. More pressure. Exhale, I'm contracting my core, driving my ribs downwards. Even more pressure. Inhale, pushing into the ball with my air. Exhale, driving my ribs downwards. All that's doing is lengthening out that QL muscle. For sets and reps for this, you just do what's comfortable. You go until you feel that muscle release. How do you know when it's released? It doesn't hurt as much. I remember when I came into this position, it was pretty uncomfortable. It already feels significantly better. Now I just feel like there's a ball in my back. I don't feel like a tight muscle. One last breath, inhale. Ribs come downwards. Excellent. That's the muscle release for the QL.